We have an increasingly elderly population because people are living longer. This is likely because healthcare is improving, medications are improving, and also economic conditions are improving. At retirement age, a large number of Europeans are affected by more than one chronic medical condition. This significantly impairs their quality of life and puts a large burden on the health system. Tricuspid regurgitation is an example of one of these common conditions seen in the elderly, where the main valve on the right side of the heart leaks blood backwards into the right atrium. So the most likely population to develop tricuspid regurgitation tends to be elderly population because it's a degenerative disorder and is often associated with other heart conditions such as heart failure or problems with other valves on the left side of the heart. Many of these patients are too frail to undergo treatment with surgery and only receive medical therapy that does not address the underlying problem.
Typically, these patients have very poor quality of life. It's a pretty miserable disease. The only real option is either open heart surgery, which is performed in less than 1% of cases because it's very traumatic, as it sounds, particularly for this patient cohort who are very elderly and sick, or else medical management with diuretics. But that's only really a temporary fix of symptoms, but not really treating the real underlying disease.
EIT Health is extremely committed to solving the challenges of population aging. We want people to live longer, healthier, and independent lives. We saw great potential in CroiValve. This is a solution to a chronic problem that affects a lot of people.
CroiValve started to provide patients with an option for treatment that doesn't involve open heart surgery. We implant a device through the vein in the neck and into the heart. We're really providing an option to actually treat this chronic disease and ultimately resolve the symptoms of the patients for the duration of their life. We met a number of partners through EIT Health. They supported us with our preclinical testing. It's both a timely and costly preclinical test journey. Securing the EIT Health funding meant that we actually could do that testing required to secure further investment.
Startups such as CroiValve face a long road through clinical trials, and we're committed to supporting those really revolutionary products and services to reach markets sooner so they can have actual impact on the lives of European citizens.
Securing funding from EIT Health was hugely impactful to the CroiValve programme. We have expanded to 13 people, we've moved to our own premises, and we've secured 7.2 million of funding to further develop this device and take it to patients.
For a health system, this means less hospital admissions, shorter hospital admissions. Having a device that can treat patients effectively without a need for major surgery really is very important. It's very important to support health innovation, to allow startups like this to flourish. It has been a big revelation to us to realise that these funding supports are available to startups in Europe.
We know it's a critical issue throughout Europe, and EIT Health is uniquely placed to be able to do something about it.